Can I start? Okay. Welcome to our estimated guests, colleagues, partners, and all those joining us virtually today. My name is Sylvie Brown. I'm the director of the Department of Global Infectious Hazard Preparedness in the World Health Organization, and I am the lead for the Infodemic management pillar of the COVID-19 response. It's my honor to formally open this side event of the 25th United Nations General Assembly. The title of this event is Infodemic Management, Promoting Healthy Behaviors in the Time of COVID-19 and Mitigating the Harm from Misinformation and Disinformation. We have invited global, regional, and national representatives to talk about infodemics in the current context of the COVID-19 pandemic, with a particular focus on how to manage infodemic in order to protect health. Infodemic, as you know, is the overabundance of information, bad or good, that accompanies an epidemic. This is a subject of significant importance to the UN family and beyond, as we face unprecedented challenges in responding to this global health crisis. Just before we start, I would like to indicate that we hope to have a short time for Q&As at the end. And so I invite listeners who have connected through Zoom to write their question in the Q&A with the name of the speaker to whom you would like to direct the question. And so with no further delay, I would like to invite you to listen to a message prepared by our United Nations Secretary General, Antonio Guterres.
I send my warmest greetings to this important event on mitigating the harm done to people by misinformation and disinformation about the COVID-19 pandemic. COVID-19 is not just a public health emergency, it is a communications emergency too. As soon as the virus spread across the globe, inaccurate and even dangerous messages proliferated widely over social media, leaving people confused, misled, and ill-advised. The antidote lies in making sure that science-backed facts and health guidance circulate even faster and reach people wherever they access information. This will be especially critical as we work to build public confidence in the safety and efficacy of a future COVID-19 set of vaccines. We need a people's vaccine that is affordable and available to all. Our United Nations initiative called Verified is fighting misinformation with truth. Working with media partners, individuals, influencers, and social media platforms, the content we spread promotes science, offers solutions, and inspires solidarity. Only together in solidarity with a well-informed public will we emerge from this pandemic safe and better. Thank you.
Dr. Tedros, thank you for being listed among Time's 100 most influential people in 2020. You first warned the world about the infodemic as early as February this year. Since then, many entities around the world have directed efforts toward understanding and managing the infodemic. We look forward to hearing your opening remarks.
Thank you so much, Sylvie, for that kind introduction. Mr. Secretary General, Excellencies, dear colleagues and friends, good morning, good afternoon, and good evening. I would like to start by thanking the governments of Indonesia, Thailand, and Uruguay for co-hosting this event. I also want to thank Secretary General Antonio Guterres and all of our partners who have been working hard with us to help countries manage the infodemic. I see Melissa also in the window, and I would like to thank her also, together with His Excellency, the Secretary General, for their leadership. Just as COVID-19 has spread around the world, so too have rumors and truths and disinformation, and they can be just as dangerous. Far too many people have done themselves harm based on falsehoods, self-medicating with toxic chemicals or dangerous medications. Others have not taken the precautions they should have. False information has also increased stigmatization, which becomes a barrier to seeking care for those who need it. In some cases, it has led to violence against healthcare workers, individuals, or vulnerable groups such as minorities or refugees. Misinformation also has an impact on trust. Trust in science, trust in institutions, and trust in health systems. In this pandemic, as in all health emergencies, trust and solidarity are critical. Everything that undermines, that puts lives at risk. But we can bring this virus under control if people have accurate, timely information about the basic measures that they can take to protect themselves and others. Throughout the pandemic, WHO has worked with numerous media and tech companies, including Facebook, Google, Instagram, LinkedIn, Messenger, Pinterest, Snapchat, Tencent, TikTok, Twitter, Viber, WhatsApp, YouTube, and more to counter myth and rumor with reliable evidence-based advice. I would like the leaders of all these institutions, by the way, we have been working very closely with them, and for their generous support, not only in fighting misinformation, but funding the Solidarity Fund too. As you know, WHO is now involved in a global effort to develop a vaccine. And yet, even if we are successful with this science, even the most effective vaccine will fail if the public does not have confidence in it. This is why it's so important we work together to provide the public and policymakers with accurate information and stop the spread of falsehoods that undermine this response. Today, WHO and our partners are calling on all countries to put in place national action plans to promote science-based health information and to combat misinformation. And we call on the media, technology companies, civil society, researchers, and people everywhere to keep the infodemic from spreading. Because now more than ever, the truth matters. I thank you. Thank you so much.
Thank you so much, Dr. Tedros, for those wise words. Dr. Mark Ryan, the Executive Director of the WHO Health Emergencies Program, is also here today. Dr. Ryan, you have extensive experience in responding to diverse health crises around the world. The infodemic is not confined to this pandemic, but is a feature to all health crises. Please do share with us your thoughts.
Thank you very much, Sylvie, and thank you for your personal leadership in this whole effort to cast a light upon how we better need to manage information and keep our communities informed. I have, unfortunately, a lot of direct experience of the infodemic, both the wonderful aspects of information and what it can do for the positive, but also the horrible negative implications of disinformation and misinformation. I've seen the power of communities to fight epidemics. I've seen the resilience of communities to survive disaster. But in many cases, and if I look to my experience in Ebola, in the community, people during the last outbreak of Ebola in Congo were very concerned about going to Ebola treatment centers, even though we had new treatments. They didn't want to go because there were rumors circulating that if they were to go to an Ebola treatment center, they would die. They thought the doctors and nurses would kill them and remove their organs in order to sell organs to another country. These kinds of rumors were real, very damaging to people's confidence in the system. Those rumors prevented people coming for life-saving interventions in Ebola treatment centers. We spent years collectively. Also rumors that the spread of Ebola was not real. It was a disease invented by some officials to stigmatize certain opposition and minority groups. The Director General himself spent many months engaging with all sides politically, trying to depoliticize the epidemic, and finally succeeded in achieving that. And that was a huge push towards us getting to the end of that epidemic. But all of those rumors were damaging, and they damaged the response for months. They also increased the levels of anxiety and fear in the population. And that in itself had its own negative impact. I've also worked extensively on the polio program, and I pay tribute to so many workers who gave their lives, unfortunately, were killed because of misinformation, disinformation. And the organizations around the world, our partners in the polio program, like UNICEF, have worked so hard over the years to break that cycle of misinformation and death amongst health workers. So this is why it's so important. This is not an academic issue. Epidemiology is important to contain outbreaks, and infodemiology is important to make those interventions successful. But it requires us to engage with communities, not only in a top-down approach, but really trying to understand the perception of the people, the concerns of people and communities, the reasons for their anxiety, and then try to communicate the right information in the right way, using the right format and the right tools, so that people can take care of their own health, be their own risk managers, and take care of the health of others in their family and the community. So, in essence, in my view, if we really want to invest in community resilience, we need to focus on three important things. First, we need to give the community a voice. That community needs to be informed, and that community needs to be empowered to find its own solutions with our support, not our solutions with their compliance. Meaning that we need to co-develop with communities the solutions to fight this pandemic and longer-term mechanisms to build community resilience to epidemics. We can't improvise this approach. We need to plan for it. We need to anticipate what will happen next, and we need to put resources into this so we can manage information in the most positive way possible. As many of us around the world are seeing second spikes, second waves, or whatever you may wish to call them, we're also seeing that similar wave of misinformation and disinformation, and it will not stop. Concerns for the community are the same. And the question is now, as new treatments and vaccines come online, as Sylvie said and others have said, can we ensure that we insulate and protect those wonderful interventions in a way that communities can, number one, fully understand them, two, express the concerns they have, get the information they need to increase their understanding and knowledge, and take action. Finally, I would say that in my experience, the community is the single most important pillar of fighting epidemics. We speak about the Ebola treatment centers and the helicopters and all of the stuff that gets seen on TV. That is not the solution in epidemics. The community is the solution. And they are owed by us our best service and the highest quality information, so that they may understand, so they may protect themselves, and so they may take action. As I said, the community is central, and infodemics need to be managed in order to give our communities the best chance of getting out of this pandemic as soon as possible. Thank you, Sylvie.
Thank you very much, Dr. Ryan, Mike, for your words and sharing your experience from the field and emphasizing the importance of communities in this fight against the pandemic. It is now with great pleasure that I introduce Dr. David Nabarro. Dr. Nabarro is a trusted, authoritative expert whose substantial contribution to global public health have placed him as the WHO Special Envoy on COVID-19. Once again, Dr. Nabarro, thank you for agreeing to participate today to share on lessons learned on infodemic management.
It's always really great to be invited to a meeting organized by WHO that looks really at the problems that people everywhere face when dealing with disease outbreaks. I've really enjoyed my time working with Mike Ryan on so many issues. Mike gets it. And I want to build on what Mike just said and build on what Tedros said with some practical suggestions for everybody on this webinar about moving forward on the COVID pandemic and addressing what's been defined as the infodemic in ways that actually help us to get the best possible results. So let me just take you on a journey. First vignette is this. I started working in public health in Nepal about 40 years ago. And together with some other medical teams, I was traveling on foot through villages, involved in doing some surveys to find out what the current situation was with children's health. And I remember arriving in a village and being given a cup of tea, and a lady came out and she stood next to me. I couldn't really understand what she was saying. She was speaking in Nepali, but eventually I got it. She said, "Why are you doctors here? Is it because we've suddenly got a terrible new illness? Are we all in danger? Is that why you've come along to see us?" And I thought afterwards, of course, we've come along because we want to help. We want to understand what's happening in the community. But from the perspective of the community, our arrival was actually quite scary. Perhaps there was something very bad about to happen. And perhaps we were there. We knew something that they didn't know. And that was going to put them at a disadvantage. Ever since then, I've always thought about that lady and the concerns she had. And then when I was working with Mike in West Africa on Ebola a few years ago, he said to me the same thing. He said, just what he's just told you just now. People don't like going to Ebola treatment centers. They feel they go there and they kind of disappear behind the plastic and they don't come out. And their relatives are scared as well. They're not going to see things in the way that you see them. And I suppose that's my starting point. Sylvie, when it comes to infodemic, just remember that not everybody sees information in the same way as we do. We're lucky, we've been taught public health, we've studied viruses and diseases, and we have a pretty clear idea of what we're dealing with. But others will see things very differently from us. My second point relates to another reality. You know, this new coronavirus that's causing COVID, how long have we known about it for? Really, since the end of December. That's 9 months. And each day, we're finding out a whole load of new stuff about this virus. There are 500 scientific papers appearing each day about it. So as well as different people seeing the same information in different ways, we're also dealing with a reality that there's new information coming on stream all the time. And so we're constantly learning. And that does lead to some adaptation. How's the virus transmitted? How long does immunity last? Or do masks work? All those kinds of issues. They're debated all over the place in the newspapers because new information is coming clear. So there we have these two issues. One, different people see things through their own perspectives. Number two, there is a lot of uncertainty and new information is coming available all the time. What happens in the middle of all this? I'm finding that a lot of people are really made very uncomfortable by this uncertainty. Uncomfortable and sometimes quite worried. What's going to happen? What's going to happen in the next 6 months? What's going to happen in the next year? And especially if they're working in areas that are really endangered by the disease or by the containment strategies, they're saying, oh, I'm not sure that I'm going to have a job in 6 months' time. I'm not sure that I'm going to be able to avoid this disease in 6 months' time. They get really scared. I think there's a lot of fear. Lot of fear about this virus, and a lot of fear about a lot of other viruses as well. So what happens when there's fear? What happens when there's anxiety? What happens with that uncertainty that I just mentioned just now? People look for truth. Look for something that will help them work this out. Look for something to hold on to. And that's when somebody comes along and says, you know, this is all a plot. It's actually designed to help authorities get greater control over your lives. It's not about a disease. It's just fake. And all this wearing masks, that's to make it easy for you to be arrested. Physical distancing, that's to cause trouble to you as you go about your life. Essentially, this is a plot so that other people can manipulate you. When that kind of thinking is around, when you've got varying perspectives and uncertainty in the mix, that sort of wish to hold on to something that helps you make sense of it is there. And it's there quite strong at the moment. So, what are we going to do as a collection of people who are working for the public good in the midst of this uncertainty, different points of view, and sense of people that they want to find an explanation? How are we going to help them? First of all, let's not dismiss the infodemic and some of the difficulties that come out of it as something that's illogical or irrational or to be despised. Let's embrace the people who are unsure. Let's talk with them. Let's hear them out and understand them, even if they're really angry and abusive. Let's try. And I'll just tell you, I find it super difficult when there's a tweet about me and underneath there's 30 or so comments about what a horrible person I am and I don't deserve to be in my job and how I'm just repeating what I'm instructed to do by a particular government. I don't like that stuff. But I've got to be able to embrace it and to live with it. And I've got to be able to work with people who believe that. I've got to connect. So my first suggestion for us all is let's connect. My second suggestion, as Mike Ryan has said, and I want to build on it, is let's have two-way dialogue with people and actually level with them and be clear with them what we see the issue to be, how do they understand the issue, and how can we work together on it. Two-way all the time, not just one way, not just us telling them what they must do, but two-way dialogue is key, whether it's on the radio or on telephones or actually in person. Harder to do it in person now, but without two-way dialogue, we don't get where we need to get to. Thirdly, let's do what we've been instructed to do by many, but we don't always do it in real life. Let's actually offer to the people we're working with that they are partners in the actions that we're taking. Offer to do it together. Now, I'm watching all over Europe as governments are struggling with what to do about rising case numbers. And I really see two approaches. Approach one, local action, integrated, working together, involving the religious groups, local authorities, hospitals, universities, coming together and doing a local response. And then I see another pattern where there's anxiety about whether people are behaving themselves And instead you see restrictions tightening up, curfews at 10 o'clock, restrictions on the number of people you can meet, all coming from the center. I think the former approach, where you work locally, you embrace and engage the local people and you trust them, that's got to be the way to go. So here are my 3 suggestions as I finish my remarks. Connect. Make sure we connect with people even though they don't agree with us. 2, two-way dialogue so that we explore with them as much as we can. And thirdly, try to do local organization, local coordination, and bring the people into the response. It's what worked when we were dealing with Ebola in West Africa. It's what's working in many parts of the world in dealing with COVID. And it's the only way to do this. Ladies and gentlemen, thank you for the chance to be with you. I wish you well, and I really assure you that for my part and the part of my colleagues, we're doing all we can to make sure that the infodemic is something that's good for people and helps them to be strong and empowered rather than something that adds to their sense of disempowerment and increases their sense of frustration. Thank you.
Dr. Nabarro, thank you very much for a captivating presentation and for these 3 points that we will, of course, work on in the future. As in the epidemic or pandemic, documenting our learnings, understanding, challenging and successes is a critical part of ensuring that next time we are better prepared. I'm now going to hand the floor to Dr. Claire Wardle, another passionate speaker. Dr. Wardle is going to speak about infodemic related to vaccine. Dr. Wardle will have a conversation with Dr. Kate O'Brien, Director of Vaccine at WHO. And thanks a lot, Kate, for being with us today and to accept to moderate this discussion. The subject of vaccine is perhaps one of the most talked about subject at all levels and in all fora at the moment. Dr. Wardle and Kate, you have the floor.
Great, thanks so much, Sylvie, and Claire, I'm really excited that we can have this conversation. So we're going to take a closer look at the infodemic and specifically this topic of vaccination, especially, of course, for COVID vaccines, which are yet to come, but also the bystander casualty or the overflow effect into the life-saving vaccines that we already have and deployed in all countries. And Claire, you've been studying misinformation for at least a decade, and your expertise in this field is really unique. So I guess the first thing I want to ask you about as somebody who has followed this field for so long, what's your insight into how novel is this situation that we're facing right now, this flood of misinformation right now, and especially on COVID-19 vaccine, a product we don't even have yet, and we're being sort of overwhelmed with misinformation and other things. So tell us what you think about that.
Well, firstly, thank you so much for including me in this conversation today. I was nodding very effusively with everything that David was saying, because what David talks about is empathy. And you're absolutely right. I've been studying this for a decade, and I've never seen anything at this scale. Rumors have been a problem for a long time. Again, we talked about Ebola. The idea that when humans are scared, they will turn to one another looking for explanations, and often they will turn to stories as ways to make sense of the world. And unfortunately, misinformation is a type of that. But we have the human behavior of rumors now supercharged because of platforms. And that's the difference. So misinformation isn't new, but the scale of this kind of content is new. And that makes it very difficult for us to get a handle on. And also the global aspect of this. Platforms are global. Diaspora communities means that the same rumor travels across borders in seconds in WhatsApp groups where families are connecting with one another and trying to make sense of this. So on one hand, no, it's not new. On the other hand, yes, it is. I've never faced anything like this. And to see the same rumors popping up in a WhatsApp group in Mexico City, as in Dublin, as in Melbourne, that's the thing that I'm struggling with. But although I feel that there are excellent people and we can work together on this, but that definitely feels novel.
And what's been really difficult, I think, to watch is the degree to which science is really called onto the carpet and has been questioned, and good information, credible information, has been delegitimized, particularly at a time when trust in expertise is really needed more than ever. I think that's what's kind of heartbreaking about this. And then recognizing what that impact is on the vaccine field and vaccines overall. So if this is a sort of convergence of factors that maybe have been inevitable, as perhaps some people think, both for the information environment and now, adding in the pandemic, can you just share with us a little bit of what do you think the underlying causes are of this, and what have we learned from analyses that about these longer term trends that could help us understand how to move forward in this setting?
So we certainly need to research this, and I lead a team at the moment where we're monitoring online conversations about vaccines, social posts that use that keyword. Nobody on this call will be surprised to hear that about 90% of the conversations related to vaccines are now about the COVID vaccine, even though that vaccine has yet to be produced and deployed. So exactly as you said, this is people preparing for that. And bad actors or people who are either deliberately trying to undermine trust, particularly in democratic systems, are using the kind of attacks against science deliberately and strategically, because by doing so, the plan is that when a vaccine comes in place, you have undermined the WHO, you have undermined science. So that is a strategy that we're seeing playing out right now. But on the other hand, I think, and I work a lot with newsrooms and journalists, I'm also an academic, I would also argue that we have failed to really explain how science works, how science and knowledge works iteratively, and how knowledge is developed over time, and how as we learn more as we try and duplicate experiments. And I think because of that, we have made mistakes that have allowed those who are trying to undermine science to get into those gaps. So I think we have a lot to learn about how, if we understand that people are trying to attack science, we need to be much more careful about our own communications and how we explain to the public how science works. And we can no longer just say, well, you need to trust us, because undermining trust in institutions, whether that's democratic institutions, electoral systems, whether it's news systems as a pillar of democracy, or science, that is a strategy, and we have to take that seriously.
So that's really interesting, Claire. And of course, vaccines are a particularly tricky topic for misinformation, because for as long as vaccines have been around, hundreds of years, we've always had vaccine deniers, vaccine refusers. So this is not a new entity. It's not a new experience. But now in new ways, our society is really wrestling with these new technologies, as you mentioned, and new advances in science, and different dynamics for trust in science and in authorities. So with all of that considered, is there anything you think we should not be doing, especially when we think about the future role of the COVID vaccines in helping to control the pandemic? Are there things that we've learned that are distinctly not helpful and we should remember to avoid them?
I think the biggest lesson is not assuming that people should just trust us. And as David was saying, this idea that we can have a top-down approach, people are asking questions, and on the internet, when you ask questions, you will always find the answer that you're looking for. And so whatever the messaging that is coming from traditional organizations, we can't assume that people are going to trust us. And so being able to think about peer-to-peer communications, ensuring that at the local level, people have answers to people's questions, because to your point, vaccines are complex. Every vaccine is different. Every vaccine has had different experiences during rollout. And so, of course, people start Googling and they find examples, and they use those examples as scientists to say, well, this happened over here. Why wouldn't it happen now? And I think sometimes when we think about vaccine communication, there's this sense of, we just need to focus on the positives. We just need to focus on the positives. And by doing so, there's this idea that there's a cover up about the realities that have happened in the past with different vaccines. And rather, we should have a much more, I'm going to say this, an adult conversation about the complexity of vaccines, but why they are in the long term very important for society, as opposed to saying we can't engage with the conversations that people are having online because they're using one another and their own personal experiences to say, well, I don't care what the scientists say, this is my best friend and this happened to her baby. And so as humans, we are drawn towards emotional storytelling, first-person storytelling. And so those of us who work in the fact-based space, we think, well, more data, more facts, that's the answer. Well, actually, humans work in an emotional space. And I think those of us who work in the fact-based space, journalists, researchers, health authority workers, we think about people having a rational relationship to information, but they don't, they have an emotional one. So I think the challenge for us as we think about communicating around vaccines is how can we communicate the nuance and not be afraid of recognizing that people are asking questions about this, because we can't control this dialogue. And David's absolutely right. This has to be a dialogue as opposed to trust us, we're going to tell you the truth and you just need to accept it.
So Claire, you've really sort of resonated on the emotional storytelling, and I think it really wraps into what David was describing and sort of imploring about the importance of the community conversation. Just as a last question, as we think ahead to the coming decade, how can we be better prepared? Is there really an example of how we could put into place some preventive measures in public health to, try to avoid future epidemics and pandemics is something we're really focusing on. But is there, and would it ever be possible even to prevent a future infodemic? And how might that actually happen?
So I think we need to recognize it's not going to happen overnight. This is about ultimately spending much more time with people to help them understand how information is created, where they can go for trusted sources, why they should trust those sources. We need to work with those trusted sources to be much more transparent. And I think ultimately, when we think about the vaccine conversation, if I go to Google Trends, I can see what people are searching for, and you realize that there's just a really low level of understanding about how vaccines work in the first place. I would argue if we're preparing for infodemics, how do we do a better job of creating evergreen content that it's engaging, that uses emotion as a way of making people understand these basic tenets that we're resting on? Because ultimately, I think we need to get back to basics on these issues. And if we're saying we can't assume that people are going to trust us, this is going to be a slow journey by which we have to rebuild trust with audiences. And we have to do that at a community level. And we have to think very strategically about how we can create content that will be shareable by people online, and use the same tactics to an extent, although I'm being careful with my words here. But what works in terms of the anti-vax content? What are the kind of lessons that we can learn in terms of mimicking those kind of tactics, while being very careful that this has to be rooted in science? But I think this is a big moment for those of us who work in communications to think about how to do communications in an era of a networked internet audience. And I think that's the biggest lesson for all of us.
Claire, thanks a lot for joining us. We're going to wrap up there. I think we're really going to sort of emphasize the emotional storytelling, trusted sources, vaccine literacy, I think, is something you've really emphasized, and trust building in communities through the communication that we have. So I'm going to hand it back over to Sylvie. Thank you so much, Claire.
Thank you.
Thank you very much, Dr. Wardle and Dr. O'Brien, for your insights. In the next section of the event, we are going to highlight the exceptional action being taken by 3 countries to manage aspects of the infodemic: Indonesia, Thailand, and Uruguay. Our first speaker is from Indonesia. It will commence with a short message from His Excellency Johnny J. Plate, the Minister of Communication and Informatics, followed by a presentation from Samuel A. Penjarapan, the Director General of Informatics Application in the Ministry of Communication and Information Technology of the Republic of Indonesia. The DG Penjarapan is going to talk about Indonesia's experience of managing the infodemic through a multi-stakeholder and digital literacy approach.
Distinguished guests, ladies and gentlemen, on behalf of the government and the people of Indonesia, I wish to express the highest appreciation to the World Health Organization's committee for the tremendous effort, not just in organizing this program, but also their relentless work in assisting nations over the globe, navigating out from the pandemic. In responding to the COVID-19 pandemic, the people of Indonesia are aware that the pandemic is not just a medical problem. There lies a greater problem in the matter of public perceptions and trust over information, so-called the infodemic problem. Reflecting on our experiences in busting false informations, Indonesia put its sole focus on improving the nation's digital literacy through various digital literacy activities, technological solutions such as social media, informations and news channels, chatbots, and mobile-based applications, Peduli Lindungi, have also been developed and deployed to support the effort in tackling the infodemic. Underlying the Indonesians' cause in the spirit of collaborations. This work are implemented with a pentahelix approach involving other public agencies, industry, scholars, the media, and most importantly, the grassroots communities. I am hopeful that the Indonesians' experience will spark similar efforts in other countries and develop fruitful collaborations among nations. Infodemic is a shared problem that requires a collective solutions among us. Let us work together to strive out this pandemic safe and sound. Stay safe, stay healthy, and stay agile. Thank you very much.
Thank you, everybody, distinguished guests, ladies and gentlemen. Thank you for inviting Indonesia in such important event to sharing our experience on handling the infodemic. I would like to personally represent the Minister apology for not being able to attend this event, but the rest assured his message and strong spirit are staying here with us. With that being said, allow me to present the pandemic situation in Indonesia. Can I move the next slide, please? There are three least common type of information disorder discovered in Indonesia. Namely, is misinformation, disinformation, and malinformation. These three categories we are handling differently. For example, for the information, we is already considered as a crime. So it's we are going to inform the police because malinformation is creating or manufacturing to create the chaos. This is we are considered as a criminal in Indonesia, especially if creating the disorder in the people. There is three. There is three common, and then two. There is two proper medical true incomplete. Two most concerning issue. Two most concerning issue. Okay, so there is a incomplete understanding of proper medical situation and procedure by the public. This leads to various problems such as the COVID stigmatization of doctor and the medical worker. Also for the survivor. Another problem is the hesitation of adapting the proper medical protocol until acquisition toward the hospital malpractice. This kind of problem that occur in Indonesia. Second is rising the final scam using medical related motive. Some people selling the supplement as the medicine. This is also a problem. Next slide, please. So during January 2020 to September 2020, we are found around 1,141 related to hoax topic. In response to that, we have to take down around 1,725 COVID-related hoax posts. From the total hoax is 1,948 hoaxes posts. If you see the numbers, sometimes they are posting more than once. This is only the type, so the spreading is not including. Next slide, please. On countering the infodemic, we aim to this level. We aim on 3 levels, namely upstream, middle stream, and downstream level. In the upstream level, we are collaborate with the 108 communities, academies, government institutions. So we are not doing the literacy by ourselves on handling this matter. To carry out information literacy education coordinating by the National Digital Literacy Movement called Cyber Kreasi. We are also humbling to share that Cyber Kreasi has recently been awarded as the winner in WSIS ITU Prize 2020. And it has sparked many similar initiatives at the grassroots level. In the middle stream level, the ministry carry a series of serious rapid action to remove access to the website, platform, or account circulated false information on COVID-19. Our contracting apps, we also use our contracting app like Peduli Lindungi that has been downloaded by more than 4 million of Indonesia, also fully operating. In the downstream level, the ministry supported a law enforcement action to prevent the spread of fake news, especially that can cause problem with the health of the life in Indonesia. Next slide, please. Tackling the entire infodemic challenge requires approach that foster sustained behavior change. Our approach is to using the pentahelix approach, where including government, community, academy, business, and media to overcome this problem. This pentahelix approach has been Indonesia's unique way of managing the spread of harmful information. As we have appreciated this discussion that we have National Digital Literacy Movement called Cyber Kreasi, which gathers various kind of stakeholders on digital issues. Next slide. This pandemic encourages us to transfer our activity to be more digital-centric and push us to accelerate our existing digital transformations agenda. In line with our president mandate, we are doing by increasing telecommunication infrastructure, establishing national data center for the government use, and national telecommunication monitoring center, the creation of digital transformation roadmap, improvement of Indonesia digital talent, and the issues of the supporting legislative and policy. Next slide, please. Distinguished guests, ladies and gentlemen, let us create more helix with the collaborating with the various part of the society while catering its society uniqueness both online and offline. There is no better time to encourage the public to be more digital centrist, diminishing digital disparity and divided by reinforcing digital transformation agenda in our respective country. Learning from each other's best practice on managing the infodemic will be the best action step to do, as collaboration has been one of the integrated elements on our mission to combat the infodemic. The problem of infodemic is not just the HW problem, it's not just UN problem or the government problem. It is our shared problem waiting to be resolved. I'm wishfully that our sharing vision and strength will be navigated us up through the pandemic COVID-19 and its infodemic. Thank you for your attention. Stay safe, stay healthy, and stay agile. God bless you all. Thank you.
Thank you very much for this extremely interesting presentation. Thank you, His Excellency Plate and DG Benjarapan from Indonesia. Very enlightening to see your experience. As we are running a little bit over time, I would like to invite our panelists to check the Q&A and answer some questions while we are progressing through the program. And I will then keep a few good questions at the end if we have enough time and we can answer them live. I would like now to introduce Dr. Supakit Sirilak, Deputy Permanent Secretary for Global Health in Thailand, to share some experience from Thailand.
Good morning, good afternoon, good evening, colleagues around the world. In this presentation, I will briefly discuss Thailand's experience in managing infodemic. This is an overview of the presentation. WHO DG declared COVID-19 as a public health emergency of international concern on 30 January 2020 and pandemic on 11 March 2020. Thailand detected its first case in early January 2020. It was the first case reported from outside China. Local transmission triggers government actions. On 12 March, Thailand established the Center for COVID-19 Situation Administration, or CSA, led by the Prime Minister. It is the single command center employing a whole of government approach for effective management of COVID-19 response. On 26 March, Thailand declared a state of emergency due to a spike of infection. A national curfew was enforced in early April, where social gathering activities are banned, and temporary ban on alcohol sales to limit social gatherings. On 8 July, Thailand declared that the first wave of the COVID-19 outbreak was ended. Amid the growing burden of the pandemic, there is a parallel proliferation of fake news and misinformation surrounding COVID-19. WHO defines infodemic as ambiguity, uncertainty, and sometimes low-quality misleading statements. WHO Director General Dr. Tedros said that we are not just fighting an epidemic, we are fighting an infodemic. A vast amount of misinformation, rumors, and conspiracy theories from unfiltered channels, often disseminated through social media and other outlets, pose a severe threat to public health. The leading agency that manages misinformation in Thailand is the Anti-Fake News Center under the Ministry of Digital Economy and Society. In October 2019, it identified around 8,000 messages on social media as possible misinformation. The graph showed that the spike of confirmed cases was followed by the increase of fake news, rumors, and conspiracy theory about COVID-19. False information can undermine the country's efforts to combat the pandemic effectively. Four characteristics frame design of infodemic management. First, centralized public risk communication system by the Center for COVID-19 Situation Administration, led by the Prime Minister. Second, one official daily situation report live television in all media channels, delivered by standing national spokesperson. Third, information and message were verified, evidence-based, and transparent information was simplified into language easily understood by the public. Fourth, cross-sectoral collaboration within government and with private sectors, both health and non-health amplify the messages and reach a broader audience, especially for the vulnerable population. The slideshow flow of information as explained in the previous slides. CCSA serves as the center of information flow to all audience groups. Thailand monitors contents of misinformation and assess citizens' capacity to differentiate right and wrong statements. In collaboration with the Ministry of Digital Economy, Thai Health Promotion Foundation, Anti-Fake News Center, and with support from WHO, we conducted a 10 weekly online survey to assess people's media literacy and behavior on sharing misinformation related COVID-19. The survey was conducted between May and July. The survey in the first 8 weeks assessed media literacy index, and the last 2 weeks we assessed the existing risk communication system. The survey collected response from a total of over 68,000 respondents. Here are key findings emerged from the survey. First, misinformation is everywhere. It transcends across country and with country to all population groups. The penetration of misinformation to social media was so deep into the fabric of society and can hinder the efforts to fight the pandemic when citizens were misinformed. 82% of Thai population have seen misinformation and disinformation in social media. And the level of media literacy is at 69%. It means that only 54% of the people are able to differentiate the true and false information related to COVID-19. Fortunately, very few of the population participated in sharing misinformation through social media. Second, Thai population reported that health agencies are most trustworthy and transparent sources of information. The live TV daily briefing is vital in building public confidence and adherence to government interventions. Third, managing infodemic and counteracting misinformation require whole of society approach beyond the health sector mandates. For example, in the early phase of the outbreak, people were not well aware and comply with interventions such as use of face masks and physical distancing. However, when a Thai celebrity couple posted on social media that they have been tested positive for COVID-19 and explained how dangerous the disease was, it stimulated compliance among their followers. We identify 5 policy recommendations for infodemic management. First, we need to strengthen fact-checking capacity in collaboration with WHO and international partners, both in the health and non-health sectors. We also have to develop a clear guidance and plan with responsibility of implementing agency. Second, it is critical to strengthen multi-sectoral collaboration to disseminate trustworthy information and counter misinformation to the public on social media platforms. Third, strengthen regulation, timely and effective sanction of Ministry of Digital Economy in counteracting misinformation. Fourth, to work with social media providers such as Facebook and Twitter to ban and terminate accounts with disseminate misinformation. Lastly, develop mechanisms and tools such as artificial intelligence, which prevent recycle of misinformation and false statements in social media. Thank you very much for your attention. and peace. Stay safe and stay healthy for everyone. สวัสดีครับ
Thank you very much, Dr. Cyrilak, and I would like to congratulate Thailand on their efforts. Our final national representative is from Uruguay, Ingeniero Pablo Orifice, Director of the e-health initiative Salud.uy from Uruguay Presidency. Dr. Orifice will address the topic of infodemic management in the context of digital transformation. Thank you. You have the floor.
Thank you very much. I will speak in my native language. Buenos días a todos. Mucho gusto de estar aquí presente. Gracias a la invitación, gracias a las autoridades, panelistas y participantes. Next, please. Un poquito quiénes somos, dónde estamos. Estamos en América del Sur, cerca de Argentina y Brasil. Somos 3.5 millones de habitantes. Ahí hay unos indicadores como para que tengan una perspectiva de nuestro país y cómo estamos situados, digamos, globalmente. Next, please. Uruguay básicamente trabaja en lo que tiene que ver con la transformación digital a partir de la reforma de salud. Allí por el año 2005-2007 se comenzó un proceso de reforma de salud y efectivamente lo que se entendió es que necesariamente debería haber una transformación digital en el sector, y para ello a partir de 2012 empezamos a trabajar con todo el ecosistema de salud. Ese ecosistema básicamente nos llevó a que hoy en Uruguay existe la historia clínica digital de todos sus habitantes y que tenemos todos los healthcare providers, todos los prestadores de salud conectados a una web segura y transmitiendo e interoperando información clínica para el bienestar del usuario, del paciente de salud, y por consiguiente esa información hoy viaja en el caso de la necesidad de una asistencia asistencial, no importa en qué prestador y no importa en qué lugar. Next, please. Básicamente, ¿qué trabajamos con el tema del COVID-19? Efectuamos un plan nacional de coronavirus multisectorial, donde el gobierno y el Sistema Nacional de Emergencias toman el proyecto desde sus inicios. El primer día que se encuentra un caso positivo en Uruguay, inmediatamente se emite una declaración de emergencia y a partir de ese momento se accionan todos los mecanismos para llevar adelante ese plan. Next, please. Yendo efectivamente a la estrategia de infodemia, les podemos decir que principalmente lo que tenemos es basado en la transparencia activa. Ese es un principio y es uno de los pilares donde trabajamos todo lo que tiene que ver con infodemia. Queremos que efectivamente la transparencia activa es aquello que puede mitigar estos efectos, pueden bajar los riesgos, un poco como decía David, existe cierto temor en la sociedad y creemos que la transparencia activa es el medio y el mecanismo para llevar adelante esa tranquilidad y llevar adelante información certera. Eso implica, obviamente, trabajar fuertemente en coordinación con los marcos legales de acceso a la información pública, de transparencia, obviamente, y de protección de datos personales, que son derechos que no deben ser en ningún momento puestos a consideración en base a una emergencia sanitaria, o sea, deben prevalecer y efectivamente se deben de fortalecer. Existe también una obligación y una responsabilidad de los funcionarios públicos de proveer información basada en evidencia. Tenemos que respetar todas las voces, pero efectivamente debemos proveer esa información, debemos proveer a la prensa, los medios de comunicación, la información oficial, continua y constante. Lo que hicimos fue transparentar continuamente datos y los métodos estadísticos inclusive utilizados para la toma de decisiones. Producimos información en lenguaje apropiado, efectivamente para llegar a la población, y para darle fácil comprensión de la misma a la audiencia más amplia, siempre enfocándonos en la población de nuestro país. Desarrollamos alineamientos de comunicación basados en la transparencia y basados en bajar esos riesgos que habíamos enunciado, y tratando de que el anuncio temprano de los riesgos fue a favor de la estrategia que veníamos llevando a cabo. Por eso el primer día efectivamente se tomaron medidas a nivel de gobierno. Aquí en Uruguay, para que aquellos que no nos conocen, jamás hubo obligación de permanecer en sus domicilios, sino fue todo un tema voluntario, explicando, desarrollando cambios en el comportamiento y dando la información necesaria en tiempo y forma. Y es notorio, uno mira las gráficas de movilidad de nuestro país y es notorio el acatamiento voluntario que tuvo la población y efectivamente cómo hizo caso a esas recomendaciones que venían por parte del gobierno y por parte de una estrategia que también implementó el gobierno, que fue llamar a un grupo asesor científico para que efectivamente trabajara asesorando y recomendando acciones al gobierno desde el punto de vista de la evidencia, desde el punto de vista científico, perdón, desde el punto de vista de la academia, para que efectivamente las decisiones que se toman estén basadas en ello, ¿no? El cumplimiento de las obligaciones estatales de transparencia activa resultan esenciales para una respuesta adecuada a la crisis. El punto de que las obligaciones pueden verse acentuadas en un contexto de emergencia sanitaria. Es necesario profundizar en la naturaleza de estas obligaciones e impulsar estándares comunes. Tenemos que asegurar que a todos les llegue la información. Y ahí es que apuntamos a la brecha digital, garantizando el acceso universal por medios tecnológicos. Next, please. Next. Lo que nosotros hicimos es trabajar desde sitios web con información oficial, que continuamente se mantenían actualizadas, y a través de chatbots que se iban a todo el ecosistema de salud con un mismo triage, con la misma información sobre la pandemia y con las mismas formas de acceso en caso de tener síntomas o de tener alguna información. Next, please. Lo hicimos a través de website, de call centers, next, please, de WhatsApp, next, de Facebook, y next, please, lo hicimos también con una app. Entregamos una app oficial donde efectivamente brindamos información y tenemos un único triage para catalogar un triage epidemiológico desarrollado por el Ministerio de Salud Pública. Next, please. Y esa información iba a parar a todos los prestadores de salud. Next, please. Utilizando interoperabilidad, como decíamos, con un manejo de casos, de posibles casos, y efectivamente incorporamos la transformación digital de la telemedicina para poder atender de forma remota y no lograr que esa población asista directamente a las puertas de emergencias y sature las atenciones sanitarias. Por lo tanto, hicimos una estrategia descentralizada muy rápidamente entre todo el sector público y privado. Next, please. Queríamos comentar que introducimos el contact tracing, pero queríamos comentar solamente desde el punto de vista de la infodemia. Hay muchísima información sobre esta tecnología, muchísimo a nivel del mundo. Bien, como decía Claire, la información se libera totalmente, y más cuando se están hablando de grandes empresas. Por lo tanto, tuvimos que tener toda una estrategia de comunicación y de preservar los derechos de los datos personales y los derechos de las personas, y aclarando esa información a la población para que efectivamente sea adoptada. Next, please. Y nosotros con toda la información que teníamos, con todos los laboratorios públicos y privados conectando, empezamos a tener información para la toma de decisiones. Y pudimos generar mapas sanitarios y generar mapas que todos los días se les mostraba a la población en una comunicación diaria oficial sobre la cantidad de casos que tenemos, la cantidad de casos activos en los diferentes departamentos, y siempre cuántos CTI, camas de CTI había ocupadas, etc. Next, please. Hoy estamos a 6 meses de nuestro primer caso. Básicamente generamos informes epidemiológicos a través del Ministerio de Salud Pública, ellos son los que los generan, La imagen que ven ahí de nuestro mapa es la información que está continuamente todos los días en los sitios oficiales. Brindamos información sobre la mortalidad, brindamos información sobre las vías de contagio, brindamos información etaria de cómo se está comportando el virus en nuestro país, y creemos que esa es la mejor forma de luchar contra esta infodemia, ¿no? Entregando información oficial, información clara, información basada en evidencia, cómo estamos tomando las decisiones continuamente. Next, please. Este es el next, please. Este es el grupo asesor que les hacía referencia. Estos son nuestros números hoy en Uruguay. Este grupo asesor cada tanto sale en prensa para comentar cuáles son las recomendaciones y cómo está asesorando al gobierno en el manejo de la pandemia. Y por supuesto creemos efectivamente que, basado en la colaboración que estamos teniendo con, nosotros pertenecemos a la Digital Nation, somos miembros de OPS, hay un agradecimiento enorme a Marcelo D'Agostini, que efectivamente trabaja con nosotros en este tema en particular. Con todo esto generamos estrategias de cambio de comportamiento. Hemos logrado que la población de Uruguay sea consciente de esta pandemia, y efectivamente los números son los que hoy nos están avalando en básicamente un comportamiento y una solidaridad enorme del pueblo uruguayo. Next, please. Queríamos agradecer y dejarlos con la imagen de nuestro presidente, el ministro de Salud Pública, secretario y prosecretario de Presidencia, que esto es cuando ellos efectivamente están continuamente comunicando a nuestro país los avances de la pandemia, cómo vienen los siguientes pasos a seguir, cómo se van abriendo efectivamente ciertos grupos de actividad y cuáles son las estrategias a mediano y largo plazo que se van tomando. Así que agradecerles nuevamente el tiempo y quedamos a disposición para las consultas que se mencionaban. Muchas gracias a todos.
Muchísimas gracias, ingeniero. A sincere thanks to all our excellent speakers. After this rich and varied contribution, our audience, I am sure, have been inspired to pose questions and thoughts. We will now have a few moments where our speakers can answer some of the questions. I mean, the speakers were still online, some of them had to go. But before this, I would like to give the floor to Melissa Fleming, the Under-Secretary General for Global Communication. Thank you, Melissa, for being with us, and it's a real privilege to have you here. So welcome, and may I invite you now to speak.
Yes, thank you so much, Sylvie, and WHO colleagues, and Claire, and everybody who's out there joining us, and especially from the national governments who gave us these fascinating presentations, because it is absolutely essential, and it's really great to see how seriously you're taking this issue, and how extensive your plans are to combat misinformation at the national level. So, we at the UN, as you heard from the Secretary General's message, we've been treating this as has WHO from the beginning, this infodemic, as WHO coined it, as a communications emergency. As Claire said, it's of a kind that none of us has ever seen before, because we have the first global pandemic in the social media age. So we have launched a campaign in order to kind of, to counter this, called Verified. And what is Verified doing? First of all, we are starting at the source. We are actually working with First Draft News and Claire Wardle and her team to research the online conversations, study misinformation. What is their source? What are their methods? What is their distribution? So we know exactly what we're trying to work against. We then produce socially optimized content that is, as many of the panelists were saying, not only based on the dry kind of science, which people just aren't clicking on, but has some entertainment value, has human stories, has human beings who are telling the story about public health guidance. And then we're working with the platforms, all of us, asking them, and we're grateful to them for all the promotion support they're providing, and they are taking steps. We still think there's a ways to go, though, on removal and suppression of misleading, harmful information. So the second area that we're working on is behavior change. And I saw actually in the Indonesian delegate also has a whole stream on this, which is really interesting. We've launched an initiative, and we're about to launch the second campaign of it, called Pause, Take Care Before You Share, which is the objective of which is to create a new social norm, that people are really educated about misinformation, and that we have studied the behavioral science around it. So look for that new launch of Pause 2 towards the end of October. The messaging will be refreshed, and we'll be working with more partners. The third area is distribution. And I think we've heard a lot from Mike Ryan, from David Navarro, about the need to go local, to be in communities. But as Claire said, one message can start, in one part of the world and ends up way in the other part of the world because of the nature of social media and how it travels. So we're working also on the platforms. We need to be where information is circulating. It is on the platforms, good and bad, in groups and on sharing apps. And broadcasting globally from New York is not going to penetrate those groups. So we've also recruited information volunteers. We have about 18,000 and counting, and we're hoping to recruit many more around the world who are just members of the public who have signed up to become educated on misinformation, to really become misinformation experts, and to help us as content spreaders to their peers and in their groups. And we're also engaging in huge partnerships all over the world with media and with influencers who are reaching the communities that we as the UN or as WHO or as public institutions would not normally reach. So just finally, I know I have very little time, but I just wanted to flag that we are about to embark also on a vaccine confidence strategy, working with behavioral experts, also working with Claire, with 3 objectives. One, we need to sound the alarm about the scale of COVID vaccine hesitancy. I think Claire mentioned that 90% of the vaccine conversations online are around the coming COVID-19 vaccine, and it's all, there's tons of fear and misinformation already mixed up in it. Our second aim is to build confidence in vaccine ahead of the release, and the third aim is really to promote the COVAX facility, which would ensure equal access to the vaccine. We have a number of projects around this, and one that I just want to flag that I think would be useful to all of you who are on this panel and online is that we are going to be creating a practitioner's guide to how to communicate effectively tackling COVID-19 hesitancy. So look for our content out there, and there's more to come, and looking forward to working with all of you on this project. We're in it for the long haul. Thank you very much, and thank you to WHO for organizing this really important event.
Thank you very much, Melissa. And this looks like a great plan for the weeks and months to come. So we have many questions online. So I will first direct the first question to Dr. Wardle. I know you have already responded in writing, but I think many people are watching us on streaming, and so they may not have access to the Q&A. So the question is, as both academics and just people in a community, how do we improve digital literacy and not assume it is fixed, or that everyone has some level of digital literacy? Can you enlighten us about this topic? Thanks.
Yeah, digital literacy is at the heart of all of this. And I think there's been this resistance to really put money behind proper digital literacy because people think, oh, it's too slow. but actually we're going to be in this mess for a good 30 to 50 years, and we have to put the money behind proper digital literacy. And it has to be all family. This isn't just young people need to be trained. Young people have grown up with filters and manipulation. Our research shows it's actually older members of families who are more likely to share this. So we need to create innovative curriculum material that really responds to TikTok and Snapchat. It's not adults saying, this is how you read a headline. And we need to test, we need to evaluate, and we need to iterate, and we need to be doing this as quickly as possible, because yes, platforms have to do more, governments need to do more, but ultimately this has to be about building resilience amongst society.
Thank you so much. We have also a question for DG Samuel Penjarapan from Indonesia. What are the context-specific interventions Indonesia has applied to engage grassroots community in combating the infodemic? Can we have Mr. Penjarapan online? I don't know if it's possible for him to answer the question.
Yes, thank you. Thank you for the question. In response for question from Saad Musaid Khan. So on engaging the grassroots community in combating with the pandemic, we have centered our effort with the cybercrisis. We have a movement, organization movement. Actually, this is a movement consists of 180 organizations, including the government agency, NGO, and also business. So what we are doing is we are also doing the seminar or tutoring with the community, so we can create the champion among the community as the influencer among the community, so they can also teach the community, their communities. This is what our engagement. We have a program, so school influencer. Let's say we have a school influencer that teach young people that can bring the good information or straight up or the fake information. They're spread out among the communities. This is our engagement. So we have a program. We collaborate with other organizations, and we also have some kind of school or training center to educate the champion from the community. Collaboration is key. So what we have, the key is from this from the engagement is a collaboration. So we don't have to work alone. So we have to work with other organizations also. Thank you.
Okay, thank you very much. We have only 4 minutes left, so I think I will try also to convey some additional information. First, we had a statement of a representative of the International Federation of Medical Student Association, and they want to say that it has been found that youth have better resilience to the infodemic. We call on member states to follow WHO example to engage nationally with youth and civil society organizations for better infodemic management. So already we are trying to make the links with some of those organizations. Another thing is that I think it's very important for you to know as well that in hosting this event at the UN General Assembly and in collaboration with 9 other UN agencies, we have agreed on a joint statement, which will be published on the WHO website after the Infodemic webinar finishes today. The joint statement by WHO, the UN, UNICEF, UNDP, UNESCO, UNAIDS, ITU, UN Global Pulse, and IFRC will be online. The statement calls on member states to develop and implement action plans to manage the infodemic by promoting the timely dissemination of accurate information based on evidence and to all community, and in particular high-risk groups, and preventing the spread, combating misinformation and disinformation while respecting the freedom of expression. The partners urge member states to engage and listen to their communities as they develop their national action plans and to empower communities to develop solutions and resilience against myths and disinformation. For any journalists who have registered and joined this side event, we apologize that we are unable to take your questions now because we have run out of time. However, please write to mediainquiries@who.int to request interviews with the speakers and presenters of this session. The event is now drawing to a close, but this event today has placed the new phenomenon of infodemics clearly in the spotlight. It's this highly interconnected world where vast volume of information can flow rapidly between and among digital communities. There is a definite urgency with which we need to devise local, national, and global solutions to manage infodemics and mitigate the harm that may come from mis and disinformation. We have heard today positive and inspiring stories about actions already being taken to manage infodemic. We now need policies to support that action and tools to support these policies. A final word, I would once again like to thank our speakers, our guests, and the audience. More than 15,000 people were watching this event online. And I would like also to thank the team behind the scene who makes this possible. Your enthusiasm and interest is inspiring. It's now time to close this event, but not without an invitation to all those listening. As I mentioned before, everyone has a role to play. Please do get involved. You can make a difference. Thank you all.
Thank you, Kak, sudah habis kan? Iya, langsung pada keluar. Iya, keluar ya, selesai.